Hello everyone and good morning. My name is Abdulaziz, a PhD student from Faculty of Nursing at Lincoln University. Today I will present our scoping review on AI-enhanced virtual telehealth platforms for personalized post-stroke rehabilitation, covering studies published between 2015 and 2025. Stroke is one of the leading causes of long-term disability worldwide, and many patients have limited access to rehabilitation service. AI-supported telerehabilitation can be improved accesses to therapy by allowing patients to receive personalized rehabilitation at home. Although many digital rehabilitation technologies exist, research in this area is fragmented across different platforms and AI approaches. Many studies are small pilot projects with limited long-term evidence and poor system integration. So this review aimed to map existing AI-enhanced telerehabilitation technologies, analyzes their clinical and usability outcomes, and identify barriers to real-world implementation. The review focused on adult stroke patients receiving home based on hybrid rehabilitation using virtual environment, wearable sensor, or ambient monitoring systems supported by AI technologies. We conduct a scoping review, a PRISMA guidelines to systematically identify and summarize the available evidence on AI-based telehealth technologies. So, literature search included PubMed and IEE Explore and Scopus and Google Scholar, covering studies published between 2015 and 2025. These studies were included if the involved adult stroke patient receiving home-based rehabilitation using AI or virtual technologies, and if the reported clinical or usability outcomes. After applying the eligibility criteria, relevant studies were screened and selected for inclusion in the review following a PRISMA selected process. The included studies represent the various range of technologies, study designs, and rehabilitation approaches used in AI support stroke rehabilitation. So most systems combined multiple technologies such as virtual environments, wearable sensors, and AI algorithm to support rehabilitation, monitoring, and adaptation. Virtual reality and desktop-based rehabilitation environments were commonly used to create interactive therapy exercise and increase patient engagement. Wearable sensor and ambient monitoring systems were used to track patient movement and collect rehabilitation data in home environment. Artificial intelligence was applied to personalized rehabilitation programs and analyzed patient activity and adapt therapy intensity based on patient performance. Different studies implemented AI processing locally on devices or through cloud systems, each with different advantages related to speed, security, and scalability. Many studies reported improvements in motor recovery outcomes using validate clinical skills such as Fugel-Meyer assessment and the Wolf motor function test. Overall, the patient showed high adherence and positive usability ratings when using AI supported telerehabilitation platforms at home. Many studies looked at proper reporting on interoperability and cybersecurity standards, which limits large-scale uh, development in healthcare system. In conclusion, AI enabled telerehabilitation is visible and effective, but future research must focus on stronger clinical evidence, interoperability standards, and secure system implementation. Thank you for your attention.